Hi everyone, welcome back to my YouTube channel. Today we are diving into a detailed overview of corpectomy procedure. As you know, whether you are a medical student, a healthcare professional, or curious about spine surgery, this video will give you a comprehensive understanding of what a corpectomy entails. So, without a further ado, let's get started. First of all, a corpectomy is a surgical procedure involving removal of a vertebral body. This surgery is typically performed to decompress the spinal cord and nerves and is used to treat various conditions such as spinal tumors, fractures, infections, or degenerative diseases. Okay? Now, let's talk about indication for a corpectomy. So, what are the indications for corpectomy? These are spinal cord compression due to tumors, fractures, or degenerative disc disease, spinal instability, infections such as osteomyelitis, severe deformity correction. Next, let's move on to the preoperative preparation. Before the surgery, the patient undergoes a detailed medical history and physical examination. Imaging studies such as X-rays, MRI, or CT scans are essential to evaluate the extent of the disease or injury. A thorough neurological assessment and anesthetic evaluation are also performed. Lastly, the patient discusses the risks, benefits, and potential outcomes with the surgical team. Now, let's get into the actual procedure of a corpectomy. The corpectomy procedure can be broken down into several key steps. First, anesthesia and positioning. The patient is placed under general anesthesia. The positioning depends on the level of spine being addressed, whether with common positions being supine or anterior approaches and prone for posterior approaches. Incision and exposure. A skin incision is made to expose the affected vertebral segment. The approach, whether anterior, posterior, or lateral, depends on the location of the pathology. Muscles and soft tissues are retracted to provide a clear view of the vertebral bodies. Next, removal of the vertebral body. The vertebral body is carefully excised using surgical tools, including the removal of intervertebral disc above and below the affected vertebra. The extent of the removal is guided by the underlying pathology. Decompression. Decompression of the spinal cord and nerve roots is achieved by removing the posterior vertebral wall and any other compressive structures. Next, reconstruction. After removing the vertebral body, the spine is reconstructed to maintain stability. This is typically done by inserting a bone graft or a cage filled with a bone graft material into the defect. The graft or cage is secured with instrumentation like plates, screws, or rods. Now, the closure. The surgical site is inspected for hemostasis and layers are closed in anatomic order. Often, drains are left in place to manage post-operative fluid collection. After the procedure, the patient requires careful post-operative care. Post-operative care includes monitoring in a high dependency unit for first 24 to 48 hours. Pain management with a combination of medications, physiotherapy and gradual mobilization to promote recovery and patient complications and to prevent complications. A regular follow-up with imaging to assess the success of the surgery and integration of the bone graft. Like any other major surgery, corpectomy has its potential complications. Complications can include infection, bleeding, neurological injury, instrumentation failure, non-union or poor integration of the graft, and spinal instability. Lastly, let's talk about the specific techniques and considerations. Depending on the location of the pathology and patient's anatomy, different approaches can be used. Anterior corpectomy and posterior corpectomy. Anterior corpectomy, often used for cervical and thoracolumbar regions, providing direct access to the vertebral body and discs. Posterior corpectomy, less common but used in certain thoracic and lumbar pathologies, offering direct access to the spinal cord. Minimally invasive corpectomy utilizes smaller incisions and advanced imaging techniques to reduce tissue damage and recovery time. Corpectomy is a complex but crucial procedure that significantly improves a patient's quality of life. It requires a skilled multidisciplinary team, including neurosurgeons, orthopedic surgeons, and specialized nursing staff to ensure optimal outcomes. And lastly, thank you for watching this detailed overview of the corpectomy procedure. If you found this video helpful, Please give it a thumbs up and subscribe to my YouTube channel and hit that bell icon to stay updated with our latest videos. If you have any questions or topics you would like us to cover, leave them in the comments below.